Assalamu alaikum and very good evening. Welcome you all to today's webinar on unique solution of dry mouth. Thanks to the organizing committee for giving me the opportunity to conduct the meeting as the moderator. Xerostomia is a very common problematic condition of all the malignant cases, most of the malignant cases of our country and abroad, and especially for those who are receiving the radiotherapy treatment or completed the radiotherapy treatment. Though many modern techniques of radiotherapy have emerged, sparing of the salivary gland, such as parotid and other submandibular glands, are not possible. So xerostomia develops, and sometimes the quality of the life of the patient deteriorates tremendously. It may persist for months, even years. So the medicine, the remedy for the dry mouth, XyliMelts, where the time demanding and the crucial one for the treatment of these patients. Today, we are here with the two renowned speakers of United States of America. I would like to introduce them. First, Mr. Jeff Haley. He is the founder of OraCoat, VP Quest product, and he is the inventor of the best remedy of the dry mouth, that is XyliMelts. And next presenter, Mr. Mark McGreevy, Vice President, Business Development in Quest product. We have with us the knowledgeable panel of experts, our mentor, the legend of our country in the Oncology department, eminent Professor M.A. Hai, Director, Bangladesh Cancer Society Hospital and Welfare Home. And also we have Professor Dr. Sheikh Golam Mostofa, Head Radiation Oncology Department, Enam Medical College and Hospital. Professor Mr. Mokhtar Suddin, Head Radiation Oncology Department, Northeast Medical College. Professor Dr. Sarwar Alam, he is the chairman of he is the existing chairman of the Bangabandhu Sheikh Mujib Medical University, which is a very renowned hospital university of our country. And he is the chairman of the Oncology department. And we have with us also Professor Dr. Qamruzzaman Chowdhury. He is the consultant Oncology and Radiotherapy Department, Bangladesh Specialized Hospital, Dhaka, Bangladesh. And Dr. Sajjad Muhammad Yusuf, Associate Professor, Head Department of Radiotherapy, Chittagong Medical College Hospital. We are very sorry that Professor Qazi Mushtaq Hussain, the Director NICRH, that is National Cancer and Research Hospital, Bangladesh, and Professor Swapan Bandyopadhyaa, he is the Head of the Department of Radiotherapy of Dhaka Medical College, is not with us due to some unavoidable conditions. They are very much busy with another scheduled program. So now, move on to our presentation. I would like to request our first presenter, Mr. Mark McGreevy, who is the Vice President, Business Development in Quest Product, to present his topic. Mr. McGreevy.
Hello, welcome. Thank you guys for letting me present to you. I am going to take you through some of the business development we've done on the product on dry mouth and our product XyliMelts as we were trying to understand the patient, their symptoms, and then how our solution would help alleviate those symptoms, and kind of a comparison to what they were finding available at that point in time. Our research was intended for the United States so that we could understand all those factors. And so while it's geared toward the U.S. and our market, obviously there are many overreaching situations that would involve basically people around the world. So let me take you through our research, and then Jeff Haley, Mr. Haley, will go through more the details of the product, how it works, etc. So I'm going to share my screen. Let me know if you guys can all see that.
Yes, we can see.
Okay. So we worked in the United States with a group called Finch Brands. That was an extensive research organization. And we did this study last year. And what we did was we did both quantitative, qualitative research, as well as we reached out to merchants, as well as the major prescriber of our product in the U.S., which are dentists. So we held 3 90-minute focus groups with prescription drug users, cancer patients, and general dry mouth sufferers. Then we also reached out to those retailers, the merchants. So 2 different of the U.S. retailers, including Walgreens, which is the largest drug or pharmacy retailer in the U.S. with about 9,000 stores, as well as dentists. And then on top of that, the quantitative study, we were able to survey 600 respondents about their experience. I'm going to go through this presentation fairly fast. The deck of our research is about 140 pages long, and I have 20 minutes. So we've reduced that down greatly, and I will just go through it fairly quickly. So this is just a key understanding who we surveyed. What you'll see here is that we broke down our survey respondents to a target group, who was the group of people that we believe were best to target for our solution, and then the non-target customers have a low interest or a low need. What you'll see, I would not give credence to the fact that the female to male ratio is high. That is more reflective of people available for surveying. But you will see that the demographic in age skews much higher into the 45 to 55 plus area, and that in the U.S., the reason they believe they have dry mouth is prescription drugs, followed by disease, and disease states includes cancer patients. So what we were trying to get a handle on is who is our target, who should we target for our customer? What are the current dry mouth behaviors? Where do they see XyliMelts today? And then we had to look at our packaging. And our product in the U.S. is sold at retail stores, but we use the medical community to sample and influence their patients to utilize this method of relief. And then we got directly into our brand and how we can best maximize the XyliMelts brand. So we looked at the breakdown of the disorders or the primary causes of dry mouth. As I said, in the U.S., prescription drugs is very prevalent. I believe 7 of the top 10 prescribed drugs have a side effect of dry mouth, and over 1,000 total drugs have a side effect of dry mouth. So it's very prevalent in the U.S. The second area was definitively disease states, diabetes, cancer, etc. And then there is a group that really might be experiencing dry mouth, but really don't know why it's happening to them. But you'll find that people that are in a disease state or taking high level prescriptions recognize that that's where it's generating from. So the other thing, and this goes back to the demographic, that our target group really highly identified that they're 45 or older in prescription drugs and in disease state. So we know that this is a problem as you age. Not only are you not replenishing your fluids as well and causing some dryness, but then other factors, prescription drugs and disease states, which are obviously more prevalent in older patients. Then we took a look at what are the effects, what are the symptoms they're experiencing. The number one symptom was dry tongue. And I will look at this, most common is these symptoms, these first three symptoms is in morning. So as they sleep, they wake up with high levels of dry tongue, dry lips, and bad breath. And then a following list of bad side effects. And one of the areas we've tried to focus on is sleep, that it's affecting their quality of life, the dry mouth is, and one of the worst attributes of that is sleep deprivation or disturbed sleep. So, and in this, we're looking at the symptoms and our target group to our non-target group. And you'll see the target group obviously has a higher level of these symptoms than the non-target group. And that simply means the people that are recognizing they have an issue, the people that are older recognize they have an issue. And which symptoms bother them the most, also from an age perspective, it's the top three symptoms are much higher in the over 45 than the under 45 group. And then our target is about 1.5 times more likely to experience dry mouth than the non-target group. This just verifies that we're trying to break down who we should target for our marketing and business efforts. So this simply on a scale of 1 to 10, from severe, from mild to severe, the overall rating was 6.7, and our target group was 7.6. So this is not when you're having this chronic condition. It is obviously at a high level to be in that 6 or 7 number. And then once again, the most time that they experience dry mouth is in the morning. It's happening overnight, but if they're sleeping, it's in the morning when they really experience the effects of it. So these are just some simple comments from some of the surveys. That the morning is usually the worst time. They always wake up with a scratchy and dry throat. And because they're not doing anything overnight to help with their dry mouth. Jeff, we're going to talk about our product in a little while and how we solve that problem. And I won't go through each one of these, but they're experiencing dry mouth through the night, and that's really has an effect for them in the morning. And the majority of people do the old-fashioned method of treating their dry mouth by drinking water. Unfortunately, by drinking water, that causes them to need to urinate and wake up through the night to do that. Any of other methods of dry mouth recovery are going to be applied at the time they go to bed, but they're only, in most cases, they're only going to last a short period of time. So they're going to have dry mouth effects in the middle of the night. And once again, we'll talk about the XyliMelts product and how that solves this. We basically saw a need. Jeff saw this need as he developed a product to have a way to deliver our xylitol, which is stimulating saliva, throughout the night. And then this just goes into some of the merchants, the retailers, and how they recognize this growing category. In the U.S., if you were to go into any of the major retail stores and you would go into the dental care section, the oral care section, you're going to find nearly 15% of the section is so it is a very prevalent situation. And basically because of what we talked about, and mostly because of overnight care, 3 out of 5 patients really don't feel they're frustrated with their current treatments and solutions. There's nothing long lasting. There's no preventative. There's nothing that solves all my problems, etc. And, you know, constant bad breath is never something that somebody wants to experience, and they really are looking for overnight solutions. So I'm going to skip that page a little bit just so we can expedite this. Then we wanted to find out, well, how are these sufferers finding solutions? We found that many of them will go online and in store. And that you'll find though that, and that's probably a US thing, but that's why we focused our marketing in those areas as well as to the medical community. But they're more likely to visit a medical professional for dry mouth, and that's kind of a US based. 71% of the target have visited with medical professionals and spoken about their dry mouth issues. And this is probably more US based, but you see a higher level of primary care physicians and dentists, which is where, when they're having this problem, they go to for solutions. So then we looked at our current dry mouth behavior. They're using, this is US once again, 89% of them are using one or more products to treat dry mouth. They are because they're experiencing dry mouth throughout the day, they're looking for on-the-go products that they can take with them. So big bottles of a saline, a solution, are not very effective for them. And so they're leaning toward portable options that they can take throughout the day. So this just breaks out the current use of dry mouth out there right now is in the US is dry mouth sprays, washes, toothpaste, lozenges, etc., and gum. It's really the lowest level is prescription. There are prescription medications for dry mouth, but the majority of US people are trying to self-care, take care of their own problem through products that they can buy in stores. So, and what we found, and we're gonna, you know, I know I haven't gotten into the product actually, but into the research, is that the satisfaction level when they use our XyliMelts for dry mouth oral adhering disc is extremely effective and satisfied. And they're using these little discs multiple times per day. 37% are using more than one per day, and they're using them heavily in the morning, right when they get up, as well as throughout the day. So after we found, and is that 93% of the consumers that try our product and already experiencing dry mouth symptoms are feel that it's improving their life. Not only their dry mouth symptoms, but they're getting better sleep. They're not having to drink as much and urinate as much. They are and they are able to not have issues with speech and things of that nature because of dry mouth. So, and then this is about our product, which is an oral adhering disc that's applied to your gum. Jeff will get into that in a second, but it is an incredibly unique product and has many benefits that all other products on the market do not have. And then this really relates to retail stores, so just that it's very difficult to find their solutions. So once again, this goes to the fact of people are satisfied with the XyliMelts product. It has been, while this is going to be new to your market, to your country, it has been in the US for over 10 years. So, and while originally possibly identified as unique and difficult to use, once the consumers and the patients start using it, they realize how simple it is to apply. They're very easy to use as you're simply applying it to your gum, holding it in place for 10 seconds, and then it will adhere for up to 8 hours. Once again, Jeff will get into the details of that. And so then the question is, well, is this safe? If you're using it at night and it's applying to your gum, are you concerned that you're going to have a choking hazard? We, as we said, 10 years, multiple millions of applications. We've never had any real choking issues. Believe me, the adhesive strongly, and 59% of the users really believe that it's a safe method. This goes into, I won't go detail into our packaging because that's not related to you, but we realized in the US that we probably needed to do a better job in communicating what the product was in the packaging, and bring more clarity to the packaging. We utilize, and you guys will, in your market, will have a blister format, so it'll be hygienic and easily carried in a pocket or a purse, so it makes it mobile. So that kind of goes into what we found about the dry mouth sufferer. And as I said, Jeff will go into more detail around the actual product. But my company, Quest Products, was associated with Jeff about 2 years ago. Jeff had developed and invented a phenomenal product that is the fastest growing solution in the United States right now, and now getting out to other places around the world. So we're very happy to be involved in this business, and look forward to your country's involvement as well. So thank you. And I think we're going to wait for questions till the very end. Is that correct?
Thank you, Mr. McGreevy, for your nice presentation. I think question and answer session will be after the speech of Mr. Halley. Now I want to inform the House that we have also with us Professor Dayauddin. He's the professor of Barrett Medical College and Hospital. He is with us as a panelist. And now I request Mr. Jeff Halley to please speak on your topic. Mr. Halley.
Thank you.
Mr. Halley, yeah.
Salam alaikum.
Alaikum assalam.
Wa alaikum assalam.
Can you all see my screen?
Share your slides.
Yes, I will. Can you all see my first slide?
Yes.
Yeah, we can see.
Very good. What I think I should do to introduce you all to the product is show you how it is used first. And I can't see myself, so I can't tell how well you can see this. But this is what it looks like. And you want it against the gums beside a molar, upper or lower, whichever is more comfortable or easier to place. You can use your fingers to put it in your mouth, or you can just use your tongue. You push it with your tongue to a comfortable spot, then take your tongue away, and don't push on it with your finger or your tongue. Let it sit held in place by your cheek for 15 seconds, and the adhesion will begin. I do it like this. Now it's right there, and by having it not move, the adhesion will begin. If you push on it, it will move, and then the adhesion will not begin. It will not begin until it's in one place and still for about 30 seconds. Once the adhesion begins, it grows stronger over time. During the first minute, it is still weak enough that you can move it with your tongue to a new spot if you don't like the first spot. After 5 minutes, it is adhered so strongly you cannot move it with your tongue. It then requires your finger inside your mouth to break it loose so you can move it to a new spot. But still, if you move it to a new spot, it will adhere again. The key is the adhesive. When I started working on the problem of dry mouth, I wanted to find something that could stay in the mouth for a long time and therefore I wanted an adhesive that could hold a lozenge in place. And I invented the adhesive, which is all natural. It's sap from the, it's gum from the sap of the acacia tree of North Africa. Acacia gum, also called in Europe gum arabic, because it was the Arabs who first brought it to Europe. And with that, we then release flavor to stimulate saliva and cellulose gum to form a gel with the saliva. The gel that is formed by cellulose gum and saliva adheres to the mouth much better than water and much better than saliva itself. And it lubricates the mouth with a very small amount of saliva. So and while we are addressing the problem of dry mouth by stimulating saliva with flavor and causing the saliva to be an excellent lubricant by including cellulose gum, we can solve an additional problem of dry mouth, and that is tooth decay. Mouths that are dry have much worse problems with bacteria and plaque and tooth decay than mouths with a good flow of saliva. Xylitol interferes with plaque formation and reduces tooth decay. The best time to release the xylitol in the mouth is when the saliva flow is lowest, which is while sleeping. By using this while sleeping, patients who use it every night find they have far lower rates of tooth decay when they go back to the dentist 6 months later. And in addition to including xylitol to reduce tooth decay, we also include a small amount of calcium carbonate so that acids are neutralized in the mouth. For maximum benefit to reduce tooth decay, we recommend that people use 2 while sleeping, 1 on each side of the mouth. And then for dry mouth, also use it during the day as needed. So the mechanism of action, as I said, is releasing of sweet flavor of xylitol, which stimulates production of saliva. Saliva has pH neutralizing components in itself, so that increase in saliva reduces tooth decay. The saliva combines with cellulose gum to coat and lubricate, and of course the xylitol reduces plaque, which reduces tooth decay. Just a comparison to other products, XyliMelts is the only one that obtains all of these benefits: neutralizing acids, feeling good, all natural, use while sleeping, and long lasting. Early on, we did a clinical study of people using XyliMelts overnight while sleeping, and they reported that their discomfort was far lower upon waking than the baseline of no treatment, and their reports of the feeling of moisture in their mouths upon waking was much higher than the baseline of no treatment. A 3-fold increase in wetness scores. It also works for people with diabetes because xylitol has a very low glycemic index. there is no population for whom xylitol is counterindicated. It is counterindicated for dogs. It is poisonous to dogs, but for humans, there is no problem. If you take a large amount when your system is not used to it, it will cause looseness in the gut and in extreme cases, diarrhea. However, by having a very slow release of the xylitol, you can get a great benefit with a modest amount of xylitol, so that we have no people reporting problems with gut discomfort when they use 2 to 5 XyliMelts discs per day. Of course, if you were to eat 10 all at once, then you would get gut discomfort, but there is no reason to do that. I described already how to place it. This picture shows the same thing. The tan side, as you saw as I held it up, has a dimple on it, so it's easy to recognize visually because it is the tan color, and by the feel in your mouth because it feels quite different from the other side. I think I have addressed all of the topics of my slides, and it would be best to explore further with questions.
Thank you very much, Dr. Haley, for your nice and elaborate presentation regarding your product, your invention for the dry mouth. And I request all the participants for participating in the question and answer session. And we have, I think, about 9 questions. So I think you better answer. I think it's on your screen right now. Dr. Jeffy? Mr. Jeffy, yeah?
I'm looking for the chat question.
I
don't.
You don't?
I don't see any questions.
Okay.
Dr. Jeffy, please check Q&A section. You can check Q&A section.
Q&A section. Please go through the,
Just on the top.
Q&A section.
It's right next to the chat.
Chat, yeah,
Yeah.
yes.
Oh, I see it. Yes. And start at the top or the bottom?
You're on the top. You will find 11 questions there.
Okay. A patient with dry mouth and chronic GVHD and allogenic SCT. It works for all patients with dry mouth. There is no disease state that is counterindicated for use of XyliMelts. I do not know Hajmullah. What is Hajmullah?
Hajmola actually it's like a lozenge, you know. It's actually nothing is related with the salivary gland. It's sometimes some sort of lozenge and nothing else.
But
yes.
But it contains some type of sour and also some sugar and also different. It's a mixture of it's a local product from the neighboring countries.
From India.
Yeah.
The problem with when you want to stimulate saliva with flavor, of course, the best flavor to use is sour. But sour is acidic. And if you leave something acidic in your mouth for a long time, it will dissolve your teeth. It will leach minerals out of your teeth and weaken them. It is therefore very important that any lozenge, which is to stay in your mouth for some time, be non-acidic. There was a study done University of Florida of all the lozenges for dry mouth, and most of them are dangerously acidic, but XyliMelts has a pH of 8. and therefore presents no problem of acidity for the mouth. That is why when looking for flavors, I chose sweetness. Sour is very good. Another one that stimulates saliva very well is bitterness, but nobody wants bitter in their mouth all the time. Another one that stimulates well is saltiness, but if you have saltiness in your mouth, that makes your dry mouth worse. And therefore the flavor that is left that is pleasant is sweetness. And so I chose sweetness, and to use sweetness, to have a strong sweetness that is all natural, xylitol fits the bill quite well, and xylitol also reduces tooth decay. Back to the Q&A list. Yes, again, the same question about GVHD. Yes, it works for all conditions of dry mouth. There are some people who have dementia, who are unable to brush their teeth, and who are unable to control their mouth functions. And we have some nurses who are inserting the XyliMelts for those patients and finding that it works about half the time. If you were to adhere a lozenge like this to the roof of the mouth, it would be dangerous, because at the roof of your mouth, you're likely to pry it loose with your tongue in your sleep. But by putting it where we do, and I will show you where mine is, there is no risk of prying it loose with the tongue. And if it were to come loose, it would stay in the buccal vestibule. It does not fall into your throat while sleeping. So yes, a lozenge that has the right adhesive added to it will work well. And next question, long-term side effects. No, we have people who have been using it every day for more than 10 years. And there is one study with rats which showed that daily use of xylitol increased bone density in the rats, but that has not been reproduced in humans. My wife uses XyliMelts every night, and she hopes it is helping stave off osteoporosis for her, but we don't know whether it does that or not. The main reasons for dry mouth in the USA. The main reasons are medications, including antidepressants, which are a serious cause of dry mouth. My belief is that many medications, including, for example, antidepressants, are much more widely used in the US than in Bangladesh. It is therefore likely that in Bangladesh, oncology uses will be a bigger market, greater demand than other medications. The next question, number one, how frequent is dry mouth in cancer patients in Bangladesh? I don't know. Can it be used without any prescription in Bangladesh? Yes. There is no reason for it to be a prescription product in any country. Next question. How long continue in radio-induced dry mouth? There is no limit. If people suddenly start using more than 5 a day, they may find that it causes gut discomfort. But if they work up to it slowly, use 2 the first day, 3 the next day, 4 the next day, they can get up to 10 a day without having any problem of gut discomfort. And that is the only negative of use of XyliMelts. the next question, does it cause drug dependency or addiction? No, there is no sense of dependency, not even as much as there's no rebound, decrease in saliva when you stop using it. There is no, when you stop using it, your condition goes back to exactly the same as it was before you started using it. And that happens quickly in 12 hours, 10 hours. During radiotherapy, yes, you can see that I am talking normally, even though I have a XyliMelts disc in my mouth right now. And you can see that it does not, you cannot see it on the outside of my face. People often worry, well, people will see that I have something in my mouth. If you have a loose lozenge or chewing gum in your mouth, yes, everyone knows it because you hold it in place with your tongue and with your cheek. But with XyliMelts, because it adheres in place, no one can see that you have one in your mouth. There are people who get dry mouth while lecturing who use XyliMelts every time they lecture to not have dry mouth while lecturing. When I have one in my mouth at a trade show and I go for lunch, I leave it in place. I don't take it out to eat. At the end of the meal, it's still there. If it falls out while you're eating and you chew it and swallow it, no problem. It does fully dissolve. It leaves nothing behind as it dissolves. Oral mucositis. Yes, we have not found that XyliMelts makes oral mucositis worse. We have many reports of the coating effect of XyliMelts to make oral mucositis less uncomfortable. The xylitol has a coating action just like sugar has a coating action in the mouth, and the cellulose gum has a coating action that is far more powerful than the coating action of xylitol, and the two together make the mouth feel very good. If there are any places in the mouth that are uncomfortable, the XyliMelts increases the comfort. The maximum dose per day. If you work up to it, you could take 20 a day, but nobody wants to. The most I've ever heard anyone using is 10 a day. Risk of choking during nighttime use. When I first invented it, that was a major concern. And that's the reason why I decided that it should be adhered on the outside of a molar and not on the roof of the mouth. So that if it were to come loose, the risk of choking would be very low. More than 220 million XyliMelts discs have been sold and consumed. And out of the more than 220 million, we have 0 reports of choking. Xylitol is alcohol, question mark? No, xylitol, to a chemist, there is a class of chemicals that are called alcohols. It means that there is an OH, oxygen and hydrogen group, attached to the molecule at a place where it can react with other things in the outside environment. And in that sense, there are many chemicals that are an alcohol to a chemist that are not alcohols to consumers, because to a consumer, the word alcohol refers to a liquid that you can drink. And to a consumer, it's a liquid that might be dangerous to drink or might make you drunk if you drink it. But to a consumer, white powder cannot be an alcohol. Well, xylitol is a white powder until you compress it together or otherwise form it into a solid, but it's never, at temperatures that humans can withstand, it is never a liquid. So when people say, is it an alcohol and isn't alcohol bad for dryness? The answer is no. As you are using the word alcohol, it is not an alcohol. It is a carbohydrate, but it does not increase blood sugar as much as normal carbohydrates. It's a special carbohydrate that is very slowly metabolized, and even when it's fully metabolized, it raises blood sugar about 1/2 as much as normal carbohydrates that people eat. Risk of kidney stones, interesting question. Kidney stones are calcium oxalate. The amount of calcium in the disc is small. The oxalate in the disc is 0. We don't have any data one way or the other whether the small amount of calcium in the disc would increase the risk of kidney stones, but it's a very small amount. It's a small amount of a person's calcium diet every day. So there must be other factors in the diet that are more significant for calcium. Sustainable effect. Once the disc is fully dissolved, the lingering effect lasts up to an hour during the day. That is, if you have a feeling of dry mouth and you have wet in your mouth and it fully dissolves, you don't notice that it's gone until about a half hour to an hour later when you say, oh, my mouth again feels too dry, I need another XyliMelts. So yes, there's a lingering effect of about a half hour to an hour during the day. It appears to be about 1 to 2 hours while sleeping, so that you still feel the lingering effect when you wake up. In our studies of use while sleeping, and there were 2 conducted, one at the University of Washington in Seattle and one at a University of California, which showed that nearly all of the subjects felt the lingering effects of wetness in the mouth when they woke up in the morning, and felt the lingering residue of flavor in the mouth when they woke up in the morning, showing that it is effective all night long while sleeping. Next question. Why is the nomenclature XyliMelts? Well, xyla comes from xylitol, which is the main ingredient, and the word melts is our name for this type of delivery system. And by combining those 2, we have a strong trademark. A question about effects on the gingiva, the dental gums, using XyliMelts frequently for a long time. A very good question. Yes, we do have a certain percentage of people who show a sensitivity in their gums, their gingiva, to the adhesive, the acacia gum adhesive. So it's somewhere around 1 in 10,000 people who show a sensitivity right off, and they find that it causes an itchy sensation in their gums, or causes redness, or causes irritation. There is another group, a little bit larger, more closer to 1 in 1,000, who finds that they develop that sensitivity over time. They will use XyliMelts for a month or 2 months every day, and then develop sensitivity.
সাজ্জাদ ভাই, আপনি একটু মিউট করেন।
I was talking about the reaction to the acacia gum being in contact with the gingiva for long periods of time. Some people do develop a sensitivity, and they will stop using XyliMelts for that reason. For those people, we have a different adhesive, and we make the XyliMelts with that different adhesive, which is also all natural but it is not as effective. It does not adhere quickly. It adheres just as strongly, but it does not fully dissolve at just the right time. It is left on your gums in the morning when you wake up, whereas the acacia gum adhesive dissolves away at just the right time. And that is cellulose gum, gelatin extracted from beef hides, and the gelatin is all natural. It's collagen, and that makes an effective substitute for the adhesive for people who are too sensitive to the acacia gum. Next question, does it increase blood glucose? I addressed this earlier, but again, it raises blood glucose about half as much as regular carbohydrates. And we have many diabetic patients who like to use XyliMelts. It raises it half as much as glucose and much more slowly. And so they don't find that they get a spike in blood sugar from XyliMelts. Deodorant effect in the mouth. Yes. Reduced saliva causes bad breath because saliva has antimicrobials that suppress reproduction of bacteria, and saliva washes away bacteria and their products. And when you have reduced saliva, bacteria growth goes way up, and the odors produced by the bacteria goes way up. So XyliMelts increases the saliva flow, thereby reducing bacteria in the mouth and the bacterial products. There is some evidence that xylitol suppresses the growth of some bacteria, but the evidence is inconclusive. Some of the studies show that, but other studies don't. The evidence is quite conclusive that xylitol reduces the formation of plaque, a biofilm on the teeth, and reducing formation of plaque will reduce odor in the mouth as well. But it's inconclusive whether the xylitol actually suppresses the growth of bacteria. Damage to the salivary gland from long-term stimulation of saliva. There is no evidence that stimulating saliva with flavor might damage the salivary gland. Of course, all animals evolved to have food, the flavors of food stimulate saliva. And so it's been going on for millions of years. And if having your saliva stimulated by food had a long-term adverse effect, it would have been selected out by natural selection long ago. But it is an interesting question whether the XyliMelts will become less effective as the saliva gland becomes used to the flavor. We know, for example, that when you stimulate saliva by putting an object in the mouth, a small stone, if you put a small stone in your mouth, it will increase saliva. But if you leave the stone in your mouth, the effect will diminish. Your saliva increase will go away because there will be no sensation of the stone after some time. We do not find that effect with stimulating saliva by flavor. That is, the stimulation does not seem to go down as much as the reduced stimulation of a stone in your mouth. The next question about aldosterone system. I don't know enough about it to answer intelligently, but there is no chemical effect of any ingredient in XyliMelts penetrating into the blood that has been documented. Yes, the xylitol does absorb through the gut into the blood, but there's no report of the xylitol in the blood or any product of the acacia gum adhesive having any drug-like effect in the blood. Does XyliMelts require lifelong use? Well, in effect, yes. Once you have, well, if you're getting dry mouth from medication and you stop taking the medication, no, then you don't have dry mouth anymore. If you're getting dry mouth from radiotherapy to the head or neck, yes, you will have dry mouth the rest of your life. And yes, you will need XyliMelts to address to address that dry mouth the rest of your life. I first introduced this product in 2009. We now have people who've been using it every day for more than 11 years, and particularly people who have permanent dry mouth from radiotherapy to the head or neck. I think that's the end of the questions.
Thank you, Mr. Henley, for your extraordinary performance. And now I request Dr. Sajjad Muhammad Yusuf, the Associate Professor, Head, Department of Radiotherapy, Chittagong Medical College, to say a few words about the session. Dr. Sajjad Muhammad Yusuf.
By the way, I see one more question about pilocarpine, which is a drug that stimulates saliva and stimulates sweat all over the body. We do have people who are using pilocarpine who switched to XyliMelts and are much happier with XyliMelts than with pilocarpine. There's no reason to suspect any drug interaction with pilocarpine.
Thank you.
Actually, I have a question from one person. He asked me that is XyliMelts approved by MHRA?
Yes, XyliMelts is approved by MHRA as a medical device and therefore bears a CE mark for Europe and any country in the world that respects the European CE mark. We put it on the package.
Okay, thank you.
Okay, thank you. Thank you very much. So, Dr. Yusuf, Dr. Sajjad Muhammad Yusuf, are you, am I audible to you, Dr. Sajjad?
Yes,
Yeah, you are.
Are you listening?
Yes,
Are
please.
you listening now?
Yeah.
Is it okay? Are you listening? Appa?
Yes, but,
We are
yes,
listening.
but there is no video.
Okay, I am doing that.
Yeah, please.
Now you're watching.
Yes, yes.
May
Thank you.
I ask a question? I did not get time. I did not get the opportunity.
Okay.
Sir, if it goes to blood, as per your talk, so what about the plasma half-life of that drug, and what about the how long maximum it works, the drug XyliMelts? Sir.
XyliMelts is not classed as a drug by any regulatory agency. It is classed as a food in the United States.
That's good.
It is a natural health product in Canada. It is a medical device in Europe and Australia. But there is no drug effect, no chemical effect of any of the ingredients in XyliMelts. Yes, xylitol does enter the blood, and there have been studies of large quantities of xylitol injected IV into the blood to observe effects of xylitol in the blood. And there were reports that it might have some therapeutic uses to have IV injections of xylitol. Xylitol is a molecule that is manufactured by living cells in humans in most animals and in plants. It's a very common natural molecule. It's at high levels in many foods that we eat. Does that answer your question?
Yeah, thank you very much. Thank you, respected Professor Hi, sir, and respected teachers and fellow colleagues. Assalamu alaikum, namaskar, and welcome. At the very outset, I would like to give thanks to Beacon Oncology Company for arranging such an academic session, and I would like to give thanks also to both presenters for their nice, informative, and time-demanding talk. Approximately 70% of patients receiving EBRT for head neck cancer develop hyposalivation with significant alternation in the volume and consistency and pH of secreted saliva may cause chewing, swelling, speaking difficulty, then dry tongue, etc. Then dental caries also. So we face whenever the somatological complication patient, and it depends on the type of the treatment in cancer treatment, and also the cumulative RT dose to salivary gland tissue, which can be reversible, irreversible, transient, and enduring. So we doctors, oncologists face many problems. Before, at the starting of radiotherapy, within 2 weeks of starting radiotherapy, many patients, after decreasing 50 to 60% of the saliva flow, many patients suffering from this type of dryness of the mouth, and they're afraid of continuing this drug. So by developing new technologies and support such as IMRT, and RT dose can be reduced to salivary gland tissue. IMRT represent an advanced form of tridimensional conformal RT we know. So IMRT technique, then intraoral stent and use of preventive Sialox and xylimetral and saliva stimulant may reduce the incidence of xerostomia and complication of xerostomia. So we came to know many things from your lecture, and with the help of xylimetral, I think we can reduce all this problem which we are facing, and patients, they are suffering from xerostomia, dry mouth and bad breath. You have already talked. So it will be very much helpful to the patient and to us also. And thank you, Beacon Oncology. They are pioneer in this field. Always they used to deliver us new products in oncology platform. Thank you very much. Thanks to all. Thank you very much.
Thank you, Dr. Sajjad, for your comment. Professor Qamruzzaman sir, he's the consultant oncology and radiotherapy department, Bangladesh Specialized Hospital, to provide his valuable opinion regarding the product and about the patients and the treatment. Professor Chowdhury.
Yeah, thanks to speak, especially the Mark has given us some ideas about the XyliMelts, and also Jeff Haley has given a gross idea about the total these products, especially, and he has given a lot of answer to the questions regarding these products. And as you know, and which most of the cases needs of radiotherapy to treat these patients. And after giving radiation therapy, what about the technology like the IMRTs and 3D? Some of the salivary gland tissue actually damaged during the treatment of the process, and patients of this region suffers mostly with xerostomia or dryness of the mouth. So this product definitely will help our people, especially in these regions, those the patients who are suffering from the head neck cancer, having radiation therapy or even a chemotherapy patient also. And definitely we will be able to prescribe this product, and we can help our patient in this matter especially. And these are very good products which has a very less toxicities. Even these products are using for the last 10 years, but we didn't heard about these products, and especially thanks to their company and also the Beacon, they are providing these products to our countries, and some of the patients which financially capable, they can use this product for the long times, because the xerostomia and this this effect of radiation therapy lasts a couple of decades. Even the lifelong patients have to suffer from this type of symptoms. So this product will help to alleviate the symptoms. So thanks to both Mark and also the Jeff Ellis for giving the brief of about the products and their research products, and also the Beacon. They are making the product available in our countries. So also thanks to Beacon for arranging this type of programs through Zoom meetings. Thank you.
Thank you, Qamruzzaman sir, for your valuable opinion. Now I request Professor Dr. Muhammad Sarwar Alam sir, existing chairman of Oncology Department of Bangabandhu Sheikh Mujib Medical University, which is a very renowned university in our country. Professor Sarwar Alam. Professor Sarwar Alam sir. I think
he is not in here.
He is not available. I think he's not available. So I request next Professor Dr. Muhammad Dayamuddin, Clinical Oncology Department, Barind Medical College and Hospital. I request Professor Dayamuddin sir to put his comment regarding the session. Professor Dayamuddin sir, yes.
Can you hear me?
Yes, we can hear you.
Can you hear me? Thank
Yes,
you.
sir. Yeah.
Thank you, Aliya. Thanks, Beacon Palliative Care Unit as well as Beacon Pharmaceutical Limited to keep me as a panelist in this webinar on unique solution of dry mouth. This is a timely presentation. Before I say something, I must express my gratitude to heartfelt gratitude to two speakers. One is Mark McGreevy, and who is the Senior Vice President and Business Department of Waste Product, and one Jeff Haley, who is the inventor of XyliMelts and founder of the OraCoat and Vice President of Waste Product LLC. They have elaborately discussed about their product. It is a nice product and it has less side effect, and the side effect which can arise can be minimized easily. In this 18th or 19th century, especially when the senior oncologist, especially radiation oncologist, who treated the cancer patient with deep X-ray therapy, we faced many problems, especially when you gave radiation on head neck cancer or cancer in the parotid gland, or especially all the salivary gland. Patient faced severe xerostomia, and we could not treat them easily. We only advise them to chew gum or take hard candies to relieve somewhat. Nowadays, this drug has given a new horizon in the treatment of dry mouth. I think this will give us the hope that we can easily minimize the xerostomia when xerostomia occurs and patient face very trouble, especially in swallowing, speaking, and even taking breath. I think the XyliMelts is easy to use and it is a safe drug. But I have one question before I finish my space to the inventor of the drug. There is a side effect like wheezing, chest pain, and tightness of the chest. If tightness of the chest occurs in the midnight, what we can do?
Wheezing, you say wheezing, chest pain, tightness of the throat?
Is it one of the side effects of these drugs? I think.
Well, it is not a drug. It is a device that coats
Yes,
the
yes,
mouth
yes,
and
device.
throat.
This can cause side effect like wheezing or tightness of the chest. Is it?
The cellulose gum, which forms a gel with saliva and coats the mouth and is a very effective lubricant to make the mouth feel very good, can also have a feeling on the vocal cords of making your voice a little bit hoarse, or having, we say in America, a frog in your throat. It is a very mild feeling, but it is noticeable. And some people say that the feeling makes them want to cough it out. That is the only side effect that relates to what you describe.
Thank you very much.
That's your question.
Thank you very much for your answer. I also thank all of you and all the participants and oncologists, my colleagues, for participating in this webinar on unique solution of dry mouth. Thank you all.
Thank you, sir, for your nice talk. Now I request Professor Dr. Muhammad Mukhlisuddin, Head Radiation Oncology Department, Northeast Medical College, Sylhet. Professor Mukhlisuddin, sir.
Can you hear me?
Yes, sir, you're audible.
Can you hear me, Aliya?
Yes, yes, sir, you are audible.
Thanks, Beacon, for organizing such a kind of scientific seminar. Thanks to resource persons who presented their topics excellently, which is timely needed. Because as oncologists, for a long time we are facing this problem of xerostomia. In the past, just a few years ago, when there was no scope for intensity-based modulation radiation therapy, we would use whole neck radiations for treatment of head neck cancer patients. We had no scope to spare the salivary glands, so patients would suffer a lot. That was also a pain for us. By that time, there was no so much material drugs available, so some artificial saliva, some of the patients would bring from abroad. That was the only hope for the patients. And remaining thing was that we would frequently advise the patients to take the sour fruits like lemon or somewhat like this, so that the remaining salivary gland tissue, if persists, from there patient will get some salivations and would take frequently water, but that was not sufficient for the patients. That was a great pain not only for the patient but also for us. A few years ago, our national pharmaceutical company produced Pylozin that gave a bit relief to the cancer patient, but that was not sufficient. But this is a new hope for the cancer patients. Xylitol in the name of XyliMelts. So far I know, it has been identified even in the 19th century. Europeans used these as candy and chewing gums as substitute to sugar for the diabetic patients, and it got so much popular in European countries. Ultimately, you give a message that it can also be used for treatment of xerostomia. This is a great news for us. Not only for xerostomia, but also for preserving our teeth. These are the great messages for us and also for our cancer patients. Thanks you for giving this important information, and thanks all for patient sharing. Thanks.
Thank you, Professor Mukhlisuddin, sir, for your opinion. Now I request Professor Dr. Sheikh Golam Mostofa, sir, Head Radiation Oncology Department, Enam Medical College and Hospital. Professor Mostofa, sir.
Can you hear me?
Yes, sir, you are audible.
Yeah, okay. Yes, this is a very good session, as already mentioned by our specialist. And I like to say my gratitude to my teacher present here, Professor Hai, and all my colleagues. Welcome in this session, and good night. The session was very much informative, and I like to thank the two specialists who presented the materials and topics, especially Jeff Haley, who clinically presented the session. And I like to thank the Beacon Pharmaceutical and their palliative unit for arranging this type of discussions, very much important, because we are facing for dry mouth very much, because in our country we are treating the head neck cancer with external beam radiotherapy only. We have no facility for brachytherapy, locally treatment, so that everyone suffer more or less from xerostomia or dry mouth, and also they seek the drug for salivation. With this question, we usually advise them to use pilocarpine or to wash mouth very frequently, or drink water or some lozenge or chocolate like this. But the XyliMelts is, I think, this will be very much helpful for this patient, because xerostomia is a very difficult problem for some patients who cannot eat, cannot talk even. So this session is very much important, and also we like to prescribe our patient this drug. But I have one question, only one question to Jeff Haley, that he mentioned that, he told that this drug is not absorbed in the blood, but he expressed that salivation is produced through nerve stimulation. But for nerve stimulation, the drug should go through blood to the central nervous system, and the salivation center will be stimulated. So how this mechanism can work, if Jeff Kelly can answer, I will I'll be grateful to him if he can explain the question. And I thank all participants and all attendants, all questionnaires who questioned the important question, put their important question here. And I finally thankful to the presenters and for all teams of Beacon Pharmaceutical for arranging such type of meeting. Thank you.
Thank you, sir. Thank you very much. Now it's time for our mentor, the legend of our oncology world. Okay, yes, Dr. Jeff, I think, wants to talk. Please unmute yourself.
Yes.
Yeah, please. Yes.
The doctor asked
Answer. Okay.
about how the mechanism of action, if it is not by passing into the blood and affecting the salivary glands from the blood. Pilocarpine works by entering the blood and affecting the salivary glands from the blood. However, that is not how XyliMelts works. XyliMelts works by stimulating saliva via flavor. If you put flavor in your mouth will produce saliva. If you put sour flavor, it will produce a lot of saliva, or bitter flavor. Next most, if you put salty flavor, it will produce saliva. Well, also, if you put sweet flavor in your mouth, that also will cause production of saliva. Those flavors do not need to absorb into the blood to stimulate saliva. They stimulate cells in your mouth that are nerve cells, and those nerve cells trigger the stimulation of saliva without anything entering the blood. Now, of course, the xylitol itself does eventually enter the blood through the small intestine. But once it enters the blood, it has no effect on the salivary glands or any other glands of the body. Does that answer the question?
Okay, thank you.
So thank you. Now I request our mentor, the legend of our oncology world, the eminent professor, the teacher of all our teachers, Professor Emehai. Professor Emehai, sir. Yes, sir, please.
Okay, thank you. I'm happy to be here this evening. My thanks to Beacon Pharmaceuticals for organizing such a nice webinar. And I'm fortunate enough to listen from the inventor of XyliMelts. Very rare occasion we listen from the inventors, anything about a product or anything like this. And I have heard the name of XyliMelts just recently. I've never had any idea about this. From the inventor, we could know how it works and how useful it is. It's a great problem for our patients receiving radiotherapy and also chemotherapy, and also this cancer patients who suffer from mental stress. And the stress also causes high mouth. This will be a great relief for them. Lots of discussion has been taken place. Now I shall request Beacon Pharmaceuticals to keep the price at a reasonable level so that our patients can afford it. Thanks to all the participants for taking part and also taking this part in the discussion. Thank you all very much. Good night.
Thank you, sir, for your valuable opinion. I think we are near the end. Yes, please, Dr. Haley. Yeah.
Finally, more than an hour after the beginning, I would like to demonstrate how the XyliMelts disc in my mouth is slowly dissolving, and it's still there where I put it.
Good. So it's a great proof that it's working, right?
Yes.
Yes. So congratulations to the inventor for the XyliMelts. So thank you all the participants from home and abroad for making the program lively, and thanks to the speaker and both the speakers for contributing their the knowledge about their products and make the question answer sessions lively. And thanks to all the knowledgeable panelists for their contribution. And last of all, thanks to Beacon Pharma for enthusiastic support to make the program a fruitful one. Thank you very much. Thank you. Good night.